warm welcome and welcome everyone to this session. Our theme for today is implant impression techniques. And I am excited and honored to be a part of this session. And today we are discussing with the implant impression techniques. Coming to our session, what is the importance of implant impressions? Okay, and the success of implant depends upon mainly two things. First one is osseointegration, and second one is passive fit of the prosthesis. And for a passive fit of the prosthesis, you require a correct impression technique and accurate impression. And therefore, utmost importance should be given for the implant impression techniques. And what are the goals we should require while taking implant impression? Basically, 4 factors are there. First one is position. Position is like to get proper implant fixture position in the bone. That means position. Next is depth. Depth is the amount of soft tissue covered around the implant. That is depth. And third one is angulation. Angulation is like comparing to the adjacent vital structure, the amount of taper and amount of angulation that should properly record in the implant impression. And final one is soft tissue contour and or emergence profile. And basically 4 goals. First one position, second one depth, and third one angulation, and fourth one is soft tissue contour. And for a proper implant impression, these are the requisites. First one is like identification of proper correct implant components. Then second is impression trace. Impression trace can be, you can select a custom tray or a stock tray. Then third one is choosing impression materials. Mainly impression materials are using this adhesion silicone and polyether. These are the ideal impression materials for implant impression. Polyether can use if your implants are parallel only, you can use polyether, and adhesion silicone in all case along with if your implant have 15 to 13 degree angulation, you can use adhesion silicone. Adhesion silicone available in multiple viscosity. That's why that is the golden standard. Screwdriver hex, short hex and long hex. For a posterior region, you can use a short hex, and for anterior region, you can use a long hex. And final and most important things are impression copings and lab analogs. First one is impression coping. Impression copings attached to the implant fixture during impression procedure. And following the impression making, coping should be removed from the patient mouth. And impression copings are basically 2 types: open tray impression coping and closed tray impression copings. And the long ones are open tray impression coping, and the short ones are closed tray impression coping. In closed tray impression coping, one side is flat, rest of the surface is rounded. For all these impression copings, 2 parts are there: on central screw and transfer component. This is the transfer component, and this is the long central screw. And if you are using an open tray impression coping, that impression is called direct impression. If you are using closed tray, it's indirect impression. And next is lab analog. Analog means what? Similar to something else. And implant analog is similar to implant fixture, but it used in the cast only. And implant analog definition is replica of an entire dental implant not intended for human implantation. And it's used only in master cast for making the prosthesis. Once again, these are the requirements for taking impression. You need correct implant components, then impression trays, then appropriate impression material, screwdriver, then impression copings and lab analog. And impression material of choice is already I mentioned, adhesion silicon and polyether. Because of its dimensional stability, multiple viscosities are available. And coming to implant impression, there are basically two types of impressions are there, implant level impression and abutment level impression. The basic difference is implant level impressions are bone level impressions and abutment level impressions are supragingival margins. These are the basic difference in between implant level impression and abutment level impression. Implant level impression are basically two types, open tray impressions and closed tray impressions. If you are using open tray impression coping, it's called open tray or direct or pickup impression. Closed tray impression copings are using in closed tray impression. What is the basic difference is your impression tray is open in open tray impressions. And we'll discuss open tray impression technique. Open tray impression consists of two pieces, one hollow transfer component and long central screw. And indications, in which case you can use open tray impression techniques. If your implants are non-parallel, then full arch prosthetic cases, then implant seated very deep into soft tissue, then multi-unit restorations. And open tray impressions are considered the golden standard of implant impressions. And coming to tray selection of open tray impressions. First, three types of tray can use in open tray impression techniques. First one is custom tray made with acrylic. And make a custom tray with openings to accommodate impression copings. Second is stock tray, normal plastic tray. We can cut a window for the open tray impression coping and use with that impression tray, take an open tray impression. And this is the mirror trays. These trays features an open occlusal surface covered by a clear foil. Open occlusal surface with a clear foil. Through that foil, we can identify the heads of the impression tray, impression coping, open tray impression copings. Three trays, custom tray, stock tray and mirror trays. Coming to how we take an open tray impression. Once the implant placed and second stage of surgery, we should put gingival former, wait for another 10-14 days. After that, in first sit, remove the gingival former and place the open tray impression coping. Open tray impression coping. And take an X-ray for the correct, to check the seat is correct in relation with implant fixture. And select a tray and make a window to accommodate the impression coping. And after that, your tray selection is correct. Apply light body around the open tray impression coping, and tray is loaded with medium body or heavy body impression material. Then place in patient mouth. Once the impression material polymerizes, you can unscrew the impression coping screws and attach with lab analog. Okay, once again, remove the gingival former and place the open tray impression coping and take on X-ray to check the correct seatness of implant fixture and impression coping. Then select a tray, either stock or custom or mirror trays, and make a window for the open tray impression copings. And after that, apply light body around the impression coping and tray load with medium body or heavy body impression material. And place in patient mouth. Once the material polymerize, you can unscrew the impression coping screws and take it out and attach with lab analog. And after that, we send to lab. And what are the advantages of open tray? Reduce the effect of implant angulation, reduce the deformation of impression materials. And main disadvantages of open tray impressions are movement of impression copings inside the impression material, which may result in improper cross. Then rotational movement of impression coping while securing with lab analog. That also result in faulty cast. Then because of its long screw, posterior region impression making is very difficult. Open tray, two techniques are there: splinted impression and non-splinted. Splinted is for full arch cases or multiple implants are there. You can use a splinted impression techniques. Splinted also same, but the principle of splinting is all impression copings are connected with a rigid material to prevent rotational or micro movements of impression coping within the impression. And the studies shows that splinted impressions are more accurate than non-splinted. This technique also similar. First, remove the gingival former and place impression coping, and after that, join all impression coping with a dental floss. It acts as a scaffold. And top of that, apply rigid material like composite, pattern resin, acrylic, or impression plaster, and make it rigid. And after that, you select a tray, make a window, load with impression material, and place in patient mouth. Once the material polymerize, just unscrew and take it out. This is a case of lower arch multiple prosthesis, multiple implants. First splinted with dental floss. Then in this case I used composites for splinting, and once impression material polymerize, you can take it out and attach with lab analog. And material used to splint impression copings are light curing composite resin, then acrylic resin, pattern resin. Nowadays, with the help of welders, titanium bars also using. And I will play a video open tray impression technique. First, remove the gingival former and place open tray impression coping and check for an X-ray. After that, apply light body around the impression coping. Load the tray with putty and light body, heavy body material, and take the impression. Once the material polymerize, remove from the patient mouth and attach lab and log. This is the open tray impression. Next, coming to closed tray impression technique. Closed tray indications are implants are parallel to each other, only you can take a closed tray impression. Then limited intra-arch distance in tendency to gagging patient, in difficult access in the posterior mouth region also you can use closed tray impressions. Coming to procedure, similar to open tray, remove the gingival former and connect closed tray impression coping. And light body apply around the impression coping and your tray load with heavy body material and place in patient mouth. Once the material polymerize, you should remove the impression from the patient mouth. After that, you should remove closed tray impression coping from the patient mouth and attach to the lab and log and make this assembly outside the impression. That's why it's called indirect impression. And after making this assembly, correctly reseat into the impression. Once again, remove the gingival former, place closed tray impression coping, apply light body and tray load with heavy body and place in patient mouth and remove the impression once polymerized. After that, remove the closed tray impression coping from the patient mouth and attach with the lab and log and reseat this assembly into the impression. That is closed tray impression. And orienting the impression coping with the lab and log into place. That is closed tray. And coming to advantages, it's easier than visual fastening of analog and coping is more accurate because we are doing within our hand. That's why it's very easy, then suitable for shorter intra-arch distance. Disadvantages are not suitable for deeply placed implants. Then inaccurate cast related to inaccurate transfer of coping analog assembly. This step. This may result in inaccurate cast. This video regarding closed tray impression. Remove the gingival former, place the closed tray impression coping, apply light body around the impression coping, load tray with heavy body material. Once the impression polymerize, remove them from the patient mouth and remove the closed tray impression coping from the patient mouth and assemble with lab and log and correctly reseat into the impression. This is closed tray impression. And open tray and closed tray are implant level impression, and one more type is there, that is abutment level impression. Abutment level impression are supragingival margins, and this procedure is similar to a normal crown and bridge technique. Just put abutment into the patient mouth, then if you want, prepare with a diamond burr in the patient mouth and take a impression similar to normal crown impression. And this is mainly using for temporary crowns, then single body or one piece implant. For basal implants, abutment level impressions are taking. Then implant placed in non-aesthetic posterior region, in molar premolar region. Advantages of this abutment level impressions are, it's very easy. And every impression techniques have their own merits and demerits. According to the clinical situation, you should select which impression techniques to choose. Closed tray or open tray or abutment level. That's according to the clinician preference. Okay, once after taking the impression, we will send this impression to lab, and Dr. Alan will cover trial and fit-in part.